The neighborhood that you see is not the actual neighborhood that's here. This can easily be another place or another world. There's a world inside of a world that you're missing. What I was actually doing was committing suicide very slowly. When I'm Antoine Kelly, and I'm a former patient of the drug unit at the Loretto Hospital, and I'm also an alumni where they helped save my life. Well, at the age of about 15, that's when my drug addiction actually started. I was presented with some marijuana, some beer. We thought that it was nothing, it was small, but it actually graduated into cocaine and heroin. In this abandoned building, going to get high, go over to little smoke houses and get high. Once all the drugs was gone and my high had worn down, it was pretty much time to make the donuts. I want to go get high again. I walked away from all family and all friends because I didn't want them to see me get high. I didn't want to be around them because they made me uncomfortable and I was the one getting high. So I packed up a few things and I found an abandoned garage. And I literally turned that garage into a functional one-bedroom home. I went to a community and I went into a car and I got caught. It sent me to the county jail. The county jail has a program in there called West Care, where they gave me some tools, but it didn't help me make it applicable. Because it wasn't made applicable for me, I failed the program. I was thinking at that time, could I do this? Will I be successful in this? Can a change actually help me? Will I actually be accepted here? But accepted as a person? Will they honestly be able to see me and see who I am?
When he first came in, he was pale, he was fragile. And as he stayed here, his skin color began to come back. His color came back. He started to smile. He started to shine. He started to recover. The patients come into Loretto, we first want to build a relationship with them. And sometimes it's easy and sometimes it's not. So here at Loretto, they offer a lot of services to see what the patient needs to get him to hear. Because you have to get them to hear, you have to get them to buy in. They have different types of programs, and music is just one of them that happened to help Antoine calm down. Be afraid, just as long as you
stand by me. And I found that certain songs actually triggered certain events in my mind. And I still yet use it today. I walk around and I yet still play music. Music is a very big part of my life. And what it does is it helps trigger things in your mind to where it can send you places that's healthy.
Antoine's family was not only the ones affected, Antoine was affected. And people don't understand that a lot of Antoine's using was because he couldn't meet the family's expectation. So we're here to try to mediate both sides, to open the door and let everybody hear everyone.
It's an open forum, and it's an open session, and everything is placed on the table.
We're able to talk about it, we're able to verbalize it, we're able to work on our presentation to one another. We are able to work on our tone to one another.
You really don't know what your individual change will be. I created Kelly Enterprises, home repair and remodeling, and lawn maintenance service. For about a good year and a half now, it's been going strong. Behold, I desire truth in the inward part. I was able to receive my chaplaincy license. So now here I am sitting before you, a licensed chaplain. Here at the Loretto Hospital, you have counselors that will bring you to yourself. They open their arms to you and they treat you like a person. And it's a big family here.
My name is Linda Ward. I am a patient here at Loretto Hospital. I was recently diagnosed with breast cancer.
Welcome to Loretto.
Thank you.
You're welcome. Come on.
I'm coming here today to talk to Angela Waller, who is a breast cancer survivor. Today is my first day meeting her, so I am really grateful for this opportunity to talk to someone who understands what I'm going through. I hope to really have a good conversation with her to help me address some of my concerns. I was first diagnosed. I was mad. I was upset. The very first thing that came through my mind, I wish I never had came and got the doggone mammogram done. Mm-hmm. I still say to this very day, I wish I never would have got it done because I would have never known about this and I wouldn't be worrying.
Knowing is better than not knowing. Because had you not known, those tumors could have kept growing and growing, and the longer you would have waited, the harder it would have been for them to treat you. I was diagnosed at the age of 34. I've been a survivor for 12 years now. I do a lot of work as far as advocacy is concerned in the breast cancer space. Whenever I talk to a woman who's newly diagnosed, I say that this first whole area for you, I call it information overload. Because you're going to get information from your doctors, from your family. They're going to ask 50 million questions. You have questions in your head. You know, you want to probably go to the internet and look for things. But you're in a fog. This is all fresh and new. And you're just like, what do I do?
Yeah.
So
basically, that's how I feel right now. I'm like, I don't know what to do. It's all too much right now. They say that breast cancer is hereditary. No one in my family, as far as I know, had it.
Small percentage of breast cancers that are actually hereditary. All the other ones, it's so many different risk factors. My mother was diagnosed with breast cancer as well. So I did have a family history. But even when I was diagnosed, it was that question of, really? You know, I'm 34 years old. I'm trying to get married, have some babies, and now I got to deal with having breast cancer.
I mean, I don't really want to say why is this happening to me, and I mean, it's so many different things going through my mind. It's like, why me? I mean, like, what did I do?
It's really a question that has no answer. You really don't have an answer for it. You just have an action for it, and that action is to do whatever you can to survive.
This is my main thing. I'm trying to figure out how can I get through this. I'm at home. Well, I'm not going to say by myself, but I'm the only female in the house of all males. So if anything comes up, they can't do anything because me being a female, they can't do the things that I would need a female to help me with.
And there's so many resources available. Don't think that you have to go at it alone, or that you're not going to have everything that you need. There's so many organizations who are out there that's going to help people with transportation, with food, with bills, with medicine. There's a lot of opportunities out there for women. Whenever you go to the doctor, take someone with you. If you say, Angela, I don't have anybody, call me, I'll go. But the bottom line is you need that, because your mind is not always there. Right. And so to help you process the information that the physician is going to give you, to make sure that you're on top of your treatment plan.
I'm just nervous. I'm scared. I don't have my support that I had 3 years ago. My mom passed. And since then, she was my backbone. She was she was there for me. And now going through this, I don't have her in my corner.
When my mother was diagnosed at 42, she passed away at 46. I was 27. And so fast forward to when I was 34, when I got diagnosed, and she wasn't there. And to, think about her experience with it. I think it was part of it was God's way of preparing me. I'm sad that she, had to die of it, but it's part of my story. So I get it. I want you to understand the role that we can potentially play in the life of someone else. So keep that in the back of your mind, but at the forefront of your mind is living and making sure that you do everything that you have to do that.
I was slowly killing myself. At my heaviest, I was about 410 pounds and not much exercise, if any at all. And a lot of my diet consisted of, a lot of fast food. If I had to say how much fast food I had, probably 2-3 times a day. I am Dwayne Hayden, and the Loretto Hospital saved my life. It was a normal day, just like any other. Came to work, just finished eating breakfast from McDonald's, and I'd say maybe about a half hour after that, I started feeling a discomfort in my chest. It wasn't anything that I was doubled over in pain or fearing for my life at that time. It's just that I just felt discomfort, and at first I tried to ignore it. Something said, you work in the hospital, just go and get checked out, just to be on the safe side. So so I went down to the ER. They examined me and ran a few tests. I like the EKG test that looks at your heart. I was just in total shock and disbelief, that I had a heart attack. The staff here at the hospital was very supportive.
It's the food. It's the food that we...
All patients, number one, should know that they can prevent
heart attack, stroke, which is the leading cause of death. It's the number one killer right now, right? We know this. But we also need to remember, or at least acknowledge, that it can be prevented and reversed through lifestyle medicine.
So of course, the first thing that had to go was all the fast food. And she really opened my eyes and gave me all the information I needed as far as, what types of food I needed to be eating. A lot of, I could still eat meat, just lean meats, adding fruits and vegetables to my diet, whole grains, and limiting my portion sizes because, I was overeating. I got advice on, starting to exercise programs. They recommended that I work out at least 3 times a week, which was, I'd say it was a little hard, but, again, when you're making, change to your life, you got to make hard decisions.
It's about living a longer, more fulfilled life, a life that is healthy, both inwardly and outwardly.
I've lost about 40, 50 pounds. The way that I feel about myself and, and these changes, it does make me feel more confident about myself and my appearance. I'm just so happy and pleased that I did make all these changes, and I'm looking forward to living a long, healthy, and productive life. I would like to say thank you to the Loretto Hospital for saving my life.